welcome everyone to our journal summary for the month of March. The first is a meta-analysis on awake prone positioning in non-intubated patients with COVID-19 presenting with acute hypoxamic respiratory failure. In this study, they found that the use of awake proning resulted in reduced requirement for intubation. However, the effect on mortality was equivocal. So they concluded that in patients with COVID-19 related acute hypoxemic respiratory failure, awake prone positioning will reduce the need for intubation, particularly in those patients who are admitted to the ICU and are on advanced respiratory support. This is a randomized phase 3 trial on resuscitation with blood products in patients with trauma related hemorrhagic shock, and this was to be given pre-hospital. That is, pre-hospital giving blood products, will it result in better outcomes? So they randomized 432 patients, 209 into the pre-transfusion group and 223 into the crystalloid group. And in this, they found that the episode of mortality or failure to clear lactate was almost similar in both the group, which means that giving RBC or lyophilized plasma prior to admission in the hospital did not result in any better outcomes. So this was same even in terms of if you look into individual events of mortality or failure to clear lactate. The next is a study which was done on epinephrine versus non-epinephrine in cardiac arrest patients with post-resuscitative shock. This means that patients who have recovered from cardiac arrest and who are still requiring vasopressors, so in which case we will get better outcomes, giving adrenaline or noradrenaline. So it was basically a registry study. So they screened 1,421 patients. Out of this, they included 766, 481 in norepinephrine group and 285 in the epinephrine group. In this, they found that epinephrine was associated with worse outcomes. That is, there was a higher risk of in-hospital mortality, 83 versus 61. And among this also, there was a higher risk of cardiovascular mortality if we are using epinephrine. This is a small study on 1 year mortality after ICU admission due to COVID-19 infection. In this, they found that most of the patients died during their stay in the ICU, and only 1% died after getting discharged. Now, again, an important study on the impact of frailty on the persistent critical illness. It's a population based cohort study. It is basically a secondary analysis of data from a prospective binational cohort, which was taking almost 2,69,000 patients of the 168 ICUs in Australia and New Zealand. It investigated whether frailty measured with the clinical frailty scale changes the timing of onset and risk of developing persistent critical illness and subsequent in hospital mortality. And they assessed the association between frailty, which was CFS more than 5 or equal to 5, and mortality prediction using a logistic regression. And they found that the model, if it includes frailty, it is a much better predictor of mortality. That means the area under the curve is increased if we add frailty into the mortality prediction model. This is a sub-analysis of the SUP-ICU trial, that is the pantoprazole versus placebo. This is a 1 year outcome, resource use and employment status in ICU patients with risk of GI bleed. In this, they found that the use of prophylactic pantoprazole reduced the risk of clinically important GI bleeding, but this does not translate in the reduction in healthcare costs, resource use, or improvement in employment status at 1 year. The next is an important systematic review on predictors for good neurological outcome in comatose survivors of cardiac arrest. In adult comatose survivors of cardiac arrest, a GCS score of motor score of 4 or 5 at the 72 or 96 hours after ROAC, a normal NSE values at 24 to 72 hours after ROAC, SSCP N20 wave of above 4 microvolts, a continuous EEG background without discharges within 72 hours of ROSC, absence of diffusion restriction in the cortex, and deep gray matter on MRI on any day between day 2 to day 7 after ROSC were good predictors for neurological outcome with high specificity and sensitivity with almost 40% in most of the studies. And it was found that EEG, SSCP, NSE, and MRI were the most widely documented tests which are used as predictors for good neurological outcome in comatose patients of cardiac arrest. Thank you for your patience and check our website for further information.